A Dose of Health is here to bring you information, inspiration, and actionable insights from New Jerseyans, all in 15 minutes or less, who are experts in their health and wellness fields. I'm Kate Cherichello Tente, host of Healthy in the Garden State and certified fitness professional. This mini-series, A Dose of Health, is a part of our mission to bring you as many health resources as we can. Check out these episodes as well as everything from the Healthy in the Garden State brand at healthyinthegardenstate.com. Dr. Siobhan Hartigan is a board-certified urologist and urogynecologist with subspecialty board certification in female pelvic medicine and reconstructive surgery. She serves as the Director of Reconstructive Urology and Pelvic Health at Hunterdon Medical Center. In addition to general urology, Dr. Hartigan is highly trained to provide medical and surgical management of urinary incontinence, voiding dysfunction, pelvic organ prolapse, urogynecology, neurourology, and pelvic floor reconstruction in both men and women. She has won numerous awards regarding patient outcomes and improving quality of life. Hunterdon Health is also our season sponsor of our title series, Healthy in the Garden State. Dr. Hartigan, thank you so much for chatting with us. And I feel like the field of urology is one that a lot of people don't know a ton about. So can you explain just the breadth of what it all encompasses and what you do?
Sure. That's a great question. So, urology in general is the field of medicine that really focuses on everything in the urinary tract. So, kidneys, ureters, the little tubes that bring urine down to the bladder itself, and then the male and female GU organ. So especially in men, the penis, the urethra, the prostate, the testicles, that's all within a urologist realm. And then for women, the urethra as well. Gynecologists really specialize in the uterus and the female reproductive organs. And so many people actually don't know that urologists treat women. There are a lot of women that come to see urologists. I focus mostly on a urogynecology population, but women get bladder cancer, women get kidney stones, and also oftentimes women like to see women as their doctors. And so it's really nice to have a growing number of women urologists in general. Just a couple of years ago, we passed the 10% mark of the number of female urologists, just kind of overall. So that's a really big hurdle and milestone for us that I'm particularly proud of. For myself particularly, I completed a 5-year urology residency, and then I went on to do a 2-year subspecialty fellowship in female reconstructive medicine and pelvic surgery, also known as urogynecology. And what that gave me the ability to do is really hone my craft in terms of pelvic organ prolapse and incontinence therapies and reconstruction, neurogenic bladder and voiding dysfunction. And so that is now mostly my practice, and I'm really happy to provide those services. You can actually become a urogynecologist after doing either a urology residency or a gynecology residency. So both urologists and gynecologists can become urogynecologists. It's a little bit of, a tricky thing sometimes to figure out, but either specialty can get subspecialty training to then have this certification.
It wasn't until I was talking to you right before we clicked record that I realized just how rare a urogynecologist is right now. So that's incredible to hear about. And I hope that someone listening who might be going in the medical route has that now idea of, oh, this is also an option for me. And talking about patients who live with symptoms for years, so many people, and they don't come in, they don't seek further answers. What do you think it is that's holding people back?
Oh, Kate, that's such a good question. There are so many things. And, what the data shows us is that women do wait years before seeking treatment for incontinence or prolapse. It's multifactorial. Oftentimes as women, we're very busy taking care of other people, and we don't see this as, a cancer condition or a heart condition or an urgent issue that really needs addressing. But what we know is this has a massive impact on quality of life. And so when my patients come to see me, they've oftentimes gone years where they're scared to go to their kids' soccer games for fear of not having a bathroom, or they're scared to travel to see their grandkids because they're worried about wetting the bed at night. night in somebody else's house, or they're worried about traveling and getting up on an airplane to go to the bathroom too many times. So these are really, really impactful on quality of life. Why people don't seek care? We're busy taking care of other people. We oftentimes think that, incontinence or prolapse is a normal part of aging, or are unaware that there are treatment options out there. So when you go to the grocery store, you go to the drugstore, and you walk down the pads aisle, and there are so many different pads options, and people might think, oh, this is just what I have to do now, and don't know that they're actually really fantastic treatment options that are very low risk or low burden that can be really impactful and meaningful for people. So those are some of the reasons, but I see this every single day.
And from personal experience, I actually went to a urogynecologist, and that helped me. I always joked that I had the smallest bladder in the world, but then it turns out, oh, there were simple strengthening exercises that I could be doing that actually have helped me immensely. So it wasn't even that I had, a quote unquote big condition to worry about, thankfully, but it was something that was affecting me. And now I'm going, oh my gosh, there is something I can do to help, which was eye-opening too. And I think I'm a person who's usually on top of healthcare, but that was something that it took me a long time to go see too. So thank you for what you're doing and for getting the word out about it. I'd love to go a little more specific on a couple questions. You mentioned aging. I'd love to hear, what are some symptoms that you're seeing that people tend to think are normal that very much are not?
Well, one of the big things that people think are just a normal part of aging is leaking when you cough, sneeze, laugh, jump. That's something called stress urinary incontinence. When there's a stress on the bladder and a little bit of urine leaks out, this is extraordinarily common. You probably joke with your girlfriends about this all the time, like, oh, I can't go on a trampoline, or don't make me pee my pants, something like that. It's so common that it's a normal part of our, discussions or jokes, but really it's not normal. It's not normal to pee your pants when you cough, laugh, sneeze. Extremely common, but there are so many treatment options that we have that can help make this better. And one of the reasons why I love what I do, and why I love my patients, is because I love that we can do like a simple procedure or a simple fix, and they come back and say, this is life changing, and it's fantastic.
Absolutely. And if someone is getting up multiple times at night, like that's another thing you hear a lot about, to go to the bathroom, when does it get to the point that you should go see someone about that?
Yeah, so as you get older, getting up one time at night is actually quite normal. And I always use the word normal with hesitancy, but getting up once at night is quite normal. But when you start to get up two, three more times, that can be really interfering with your sleep quality, your quality of life. And so when it's two or more, I would say you should definitely come discuss it with somebody, even if starting with your primary care doctor. They can kind of get the ball rolling, and then see a specialist if you need to. Oftentimes, there are some simple things for getting up at night. That's something we call nocturia, like watching what you're drinking before bed, thinking about the timing of some medications, any swelling in your legs. One thing that people don't understand, oftentimes the association between getting up at night to go to the bathroom, is that if you have obstructive sleep apnea that you're not treating, that makes you make more urine at night. And then you're going to have to get up to go to the bathroom. So sometimes I'm the one diagnosing sleep apnea, which is kind of crazy as a urologist, but that's it's true.
Wow. Everything's tied together in different ways. It really is.
Yeah,
The
it
body
really
is
is.
complicated and complex. Going to the pelvic health aspect of your work, Kegels and pelvic floor health, there are a lot of misconceptions, a lot of confusion. Can you kind of give people an overview, or break down some of the misconceptions that you hear most often?
Sure. So one of the biggest misconceptions that I hear actually is in my population that's getting a little bit older, typically postmenopausal women. So a lot of times people will think that they just keep getting recurrent urinary tract infections. And a lot of times it's not actually a UTI. It can mimic UTI symptoms like burning, discomfort, kind of an awareness of that area of your body, urinary frequency. But one of the best ways to improve those symptoms and prevent real urinary tract infections is actually vaginal estrogen. And that's an area of medicine that we're discussing a whole lot more now. It's really lovely to see that it's becoming more mainstream and primary care doctors are becoming more comfortable prescribing this. But vaginal estrogen is actually extraordinarily safe for almost every woman that's postmenopausal. It does not get absorbed into the bloodstream. There's no increased risk of heart attack, stroke, breast cancer, blood clots, literally none of those. And it can decrease mortality. Patients actually live longer when they're using vaginal estrogen because you're at less risk of getting a true urinary tract infection, and it keeps my elderly patients out of the hospital. So if I have one tidbit to kind of pass on today, it's you don't need to be scared of vaginal estrogen. I think that we've done a really good job of scaring women for decades about even the word estrogen when you're postmenopausal. But what we know is that this is extremely safe to use.
And speaking of talking about it, we've mentioned a little bit throughout our conversation so far, but what are you seeing in terms of these topics being finally talked about more and the progress or lack thereof? What are you seeing?
Yeah, I think it's great. I mean, I think awareness is rising. We're starting to see even marketing for women, like targeted ads from different industry companies. If you start searching for something, I really don't like seeing a commercial for poise pads. I really do like seeing a commercial for a medication or a therapy intervention that's going to help these conditions. So I love that we're talking about it. My patients also tell me, oh, I was telling everybody at pickleball or I was telling everyone at church about all this. And it's great. I think we should be a little bit more open. And there's more awareness with media accounts and Facebook groups and other ways to kind of connect with people that are having similar symptoms. And I think that's just empowering to know that you're not alone.
And what are some of the most exciting advancements that you're seeing in pelvic or bladder health that maybe the public doesn't know about?
Sure. This is great. Like I love staying on top of the latest and greatest advancements. So one way that we treat a condition called overactive bladder, and a symptom within it is urgency urinary incontinence. So that is when you get the urge to go to the bathroom and you just can't make it there in time. So sometimes common triggers are like kind of walking towards the bathroom, but you can't get your pants down in time, or running water. You're doing the dishes and you're like, oh, I got to go right now, or getting out of the car and you put the keys in the door, and then all of a sudden you're like running to the bathroom. That's urgency urinary incontinence. And we actually have tons of different treatment options for this, ranging from, changes in your diet, some pelvic floor exercises, medications, bladder retraining, and then procedural interventions. So we can do bladder Botox. We do that right in the office. We can have, there's a little pacemaker that goes in your back that helps your bladder function. And then one of the newest ways of treating this is actually based on really ancient Chinese medicine. So we know that the tibial nerve, which actually goes down to your ankle, comes from the same place in your back as the nerves that go to the bladder. And so by stimulating the nerves in the ankle, we can get your bladder on a better signaling pattern and treat urgency incontinence. Now, we've been doing it percutaneously for decades at this point, but newer technology is actually a little implant that goes in the lower ankle. And this can be done just with a little bit of numbing medicine to automatically give you treatment sessions to that tibial nerve. And I've been really happy with this technology. My patients have been really excited about it. So I think, the more options that we have, the menu that we have to offer patients for this space, I think is fantastic. And it's growing. It's a changing landscape, and I'm really excited to be part of it.
I love that. And I know we're running out of time, but I'd love to hear, why did you choose this career field?
Yeah. So I didn't even know that urology existed when I was in medical school initially. Between my first and second year of medical school, I knew I wanted to do something surgical. I knew I wanted to do women's health. I thought maybe OBGYN. So I went to Africa for 2 months to get more hands-on experience, and I was crazy. I just started Googling hospitals and saw like who would take me. I don't know why this was a good idea, but that's what I did. And so I got there and I was working with some OBGYNs, and it was really cool. And I just really serendipitously got involved in a vesicovaginal fistula project there. And so a fistula is when there's an abnormal connection between two spaces. So a vesicovaginal fistula is when a hole develops, a connection develops between the bladder and the vagina. And this very frequently happens from long-term obstructed labor. So in underdeveloped countries, when patients are in labor for days, this hole can develop. And then these women just constantly leak urine. And it's really devastating to these women. So in 2 weeks in Kenya, we repaired 100 of these fistulas, and that was a life-changing experience for me. And so I knew I really wanted to do pelvic health. I knew I really wanted to be involved in genitourinary reconstruction. And so I came back and to the States and realized that urologists, this was more of like the space that they would tackle here. And so I became more interested in pursuing a career in urology. That's how I found it.
That's an incredible way to find your space in the medical field. Thanks for sharing that. And Dr. Hartigan, thank you for sharing all of this information with me today. Lots of great, valuable insights for our listeners. And please share, how can people find you, connect with you, make an appointment?
Sure. So I see patients in Flemington, New Jersey, and Bridgewater, New Jersey. My office number, I think we can provide that at the conclusion here. And you basically call, ask for an appointment. I will say that not uncommonly, it's a little bit of a wait for an appointment, but I think my patients typically say that it's worth it. And I really try to work with every patient to meet them where they are. So if you do have one of these problems, if you are interested in seeing me, that's how you can get in touch.
Excellent. And yes, and information with a link or phone number will be in the description here. Thank you, Dr. Hartigan.
My pleasure. Thanks for having me.
Thanks for tuning in. Be sure to click that subscribe button. And if you know someone who would appreciate this episode, please do share it with them. To connect, partner, or if you have suggestions and feedback for us, please reach out anytime at healthyinthegardenstate.com. Until next time, I'm Kate Cherichello Tente, and this is A Dose of Health from Healthy in the Garden State.